morning, everyone, and welcome to the Pulse of Practice webinar series, Student Edition. My name is Clifton, and I'm a second year student in BCMP, as well as the newly elected chairperson of our Clinical Associate Student Council. I'll be your host this evening, and I'm really excited to be hosting this career webinar to help us all gain some valuable insights as we prepare for our careers in healthcare. And I'm looking forward to having a great session together. So I'd like to welcome all the students and guests. This webinar is open to all clinical associate students from Wits University, University of Pretoria, and Walter Sisulu University. Usually, we often have graduate clinical associates invited to speak to us about their workplaces. However, for today's session, the Division of Clinical Associates has invited us as students to take over this last session and just reflect on the 2024 academic year. So, for today's webinar aims, we want to provide a space for students to share their journey as clinical associate students, look back at the 2024 year, and share motivation for the exam season. So today we welcome 3 student guest speakers. Each speaker will speak for about 10 to 15 minutes. We will have a Q&A session after the last speaker has spoken. Also, please do tag your year of study and the university you are from so that we can appreciate the student involvement. So let's get right into it. So we're going to start with our first year. So her name is Panalo Mashaba. She's a first year BCMP student who's already shown great enthusiasm and commitment to our field. She's eager to learn and grow in the profession, and we're excited to have her join us today to share her perspective as she starts her journey in BCMP. So Panalo, I will hand it over to you.
As I have been introduced, my name is Panala Mashaba, a first-year BCMP student at Wits. I'm a 19-year-old girl from a small village called Jericho in the Northwest Province. I matriculated in 2022 from Madiba Atulani Secondary School. I then took a gap year in 2023 and 2024. Here I am, a proud Wits student. My journey as a first year MP student has been interesting since day one. From being away from home for the first time for this long and this far, I did do a little bit of research with regards to this degree to understand what to expect. One of the things that I definitely did not expect was having to do our practicals for during our first year. I remember when we were told that we are going to be seeing patients, I was like, what do you mean we're going to be seeing patients? Because it has only been 8 to 12 weeks, I think we have been here, and we're already going to see patients. But then it was after that session that we had at the hospital of seeing patient that I understood the relevancy of having to do our practicals while it's also doing our theory. Because not only can you only learn and understand the theory of your skill without having to practice it, this then was giving us an opportunity to be able to practice the skills that we are learning, also giving us an opportunity to interact with patients this early. Another thing that I definitely did not expect was the language barrier, of which really made me realize that I still have to learn some new languages so that I can be able to talk to my patients without having to be like refer or to another colleague of mine so that I can talk to them because they know the language. So I have to know the language as well. But then with regards to the background of where I come from, it's not necessarily that I have a huge problem with language barrier. I can understand most of the languages to some extent, but then if you go beyond that extent, I cannot really understand it. It is therefore why I will say I will have to focus more on learning new languages. So my personal achievement are all based on my personal growth as an individual. A personal achievement I would like to embrace is that I'm still here. I survived from the start till this point. I got to grow not just as a student, but as an individual too. I had an opportunity to improve my communication and leadership skills, which in turn are helping me out to come out of my shell and embrace the world without fear. And also, I would like to appreciate the new skills that I had an opportunity to learn. I mean, doing the past, the BP, the physical exams, as well as interpretation of x-rays, because now I am able to use the skills that I have learned to go back home and contribute to my community. With then regards to my patient experience, there are 2 people that I really stood out for me. First was my first patient that patient that I came across with. It wasn't necessarily the patient that I was seeing, but the patient that I came across with in the bathroom of all the places. It was time for us to go back home. And then I was like, hey guys, I'm going to use the bathroom. That's where I came across this wonderful woman. So what happened was that, you know, the dress code, the scrubs, the name tag, as well as the stethoscope, I had them on. So she saw me and she asked me, are you a doctor? I said, no, I am not a doctor. And then she said, okay, I hear you. I have an issue. So I saw a doctor. The doctor changed my medication, but I don't know why they changed my medication, and I have kids. So I told her that, okay, I hear your problem, but then my best advice to give you right now is that you go back to the doctor and ask them why they changed your medication. Because from what I experienced, the way she talked to me, the way she was expressing herself, her fear wasn't necessarily that the medication was being changed. Her fear was the reason behind the change of the medication. Because if then this means whatever the medication was for, the ones that she was using before are not working and things are progressing to a level that she might get too sick to be able to take care of her kids. It was at this moment I made a vow to myself that as a future professional healthcare worker, whenever it comes to my patient, I will make sure that they are well informed about their medication, what's going on, and the reason to do one, two, three, so that they are able to understand and make sure that they do not experience what I saw that women experience, something that could have been prevented. Really did break my heart. I remember when we were on the bus back to campus, I was holding tears. I'm not gonna lie, I almost cried because it really touched me at the most deeper level, especially as a very emotional person. And then the second patient that really stood out for me again was my last patient, of which was the first patient I had for the clinical simulation or scenario, where we went to the clinic and, well, our first undifferentiated patient. Definitely, he stood out for me the most because with him, he was sick. He did get treatment prior before coming to us, so he was now complaining of something else that is still progressing and is not getting better. So he was looking for assistance with regards to that. Fine. We did the history taking along me and my partner. It went fine. And then it came to the point where we have had to order an x-ray. So we went there, took him to the x-ray room. He got the x-ray and he came back to us. So when he came back, I don't know if the people that I was with around him at that time noticed what I noticed. When he walked in with that x-ray in his hands, he was smiling. He was full of joy that, okay, I am here. I'm about to get help, the help that I need to solve this issue that I came with. And to see him that happy, it pleased me that he's happy that he's getting the healthcare services that he was really looking for, of which was to get help and get assisted, right? Yeah. And then it came to the point where we had to take out the x-ray in the envelope. Ooh, okay. We took out the x-ray in the envelope. Um, one of my seniors gave it to me to interpret the x-ray for her. I didn't interpret it, not because I couldn't interpret it, but my mind, when I saw the x-ray and I saw what was on the chest x-ray, I was like too shocked to even process things. And I realized, oh my God, this man just came in with a smile that he's gonna get help. But this is something. So, and then it came to the point where my senior left to call a doctor, and they explained to him that based on what we are seeing on the x-ray, we're gonna have to refer you to Bara, of which he understood, he complied to that. And okay, fine. So the reason this case really stood up for me was the fact that he came in, he didn't look ill at all compared to what could really be sick with him. I'm not gonna clarify what could be wrong with him because still other investigations had to be done to confirm whether to rule in or rule out that diagnosis. But then it broke my heart when I had to process the whole process that this man came with a smile when he brought his x-ray, that he's gonna get help, only to get referred. So it broke my heart that the help that he might be getting, he thinks it is for the best, which that is true. It is for the best. He's gonna get help that he needs. But the problem is that things might get too serious and too severe for him with regards to his condition. For conclusion, I wanted to say this few kind words or phrases. Self-belief and the hard work will always earn you success. So if you believe yourself, you put in the work, you will never go wrong. Also, an investment in knowledge pays the best interest. So if you allow yourself, you give yourself a chance to learn, it will allow you to really grow to a point where you really couldn't think you would reach. I mean, the sky is the limit. Also, I wanted to, with regards or reference to my experiences both in the clinical and wards sessions, I would like, or it made me realize the essence of having had done the Bokhabane course, especially when it came to emphasizing the phrase of having to take care of your patients, feel what they feel, understand where they come from, because it really shows that the most important thing about being a healthcare worker is how you see and feel for your patient before you can really do all those other services for them. And I'm really also proud to say that with all my experiences, with the people that I have been working with, I'm proud to say that we were able to uphold the Batubele principle as well as the patient's rights of charter. And I will also like to say thank you, and everybody, believing in yourself makes everything possible, and good luck with your exams and last test. Thank you. That's all for me.
Thank you so much for sharing your experience. It was really, really lovely to hear. I'm glad that you've been enjoying the year so far. Okay, moving on to our second year, we have Gabriela Franciscakis. She is a second year BCMP student at WITS. She's been a class rep for year one and year two. She's passionate about ensuring that her classmates are looked after, supported, and thriving. Her department of interest in the hospital so far is emergency medicine. So let us hear what Gabby does have to say for us.
Good evening, everyone. My name is Gabriela Franciscakis, like Clifton said. Thank you, Clifton, for introducing me. Thank you for giving us the opportunity to speak on our experiences and to just address everyone. So like Clifton said, my name is Gabriela and I matriculated in 2021 with 5 distinctions at De La Salle Holy Cross College. I then continued to take a gap year in 2022, where I worked at the Breast Care Center of Excellence under Professor Carol Ann Ben, who was originally the person that showed me this degree. I didn't know what BCMP was, and she wanted and was very passionate about me going on to study this degree to then maybe go and work for her after as well. I began BCMP first year in 2023, obviously at the University of Wits, and I was also given the role of class rep, which in the beginning I thought might be a small kind of uptake that I'd take up, but it grew to become very important to me, as well as I'm in second year now and again class rep. So my journey this year as a Clin A student, I'm just going to touch base on balancing academic pressure, rotations, deadlines, personal life, and as well as responsibilities, whether it be university-wise or personal-wise. So obviously in the side there, I've shown all the clinical work that we've been doing this year. It included our 9-week rotation from April until June, and then our current 9-week rotation, which started 6 weeks ago and we are still busy with now. We did obviously OPD, emergency medicine, internal medicine, HIV clinic, 3 weeks at primary care, which is I was placed at Alexandra Clinic, and then 3 weeks pediatrics, and now I'm in week 2 of 3 doing obstetrics and gynecology. So I learned very quickly last year the importance of time management, and I'm a very academically driven person, and I had to bite the bullet this year to grow to learn about it is everything, but at the same time it's not everything, to not sacrifice every aspect of your life to get good marks, because it has consequences at the end of the day. So keeping up with all the deadlines and as well as trying to be present in your home life and for your friends and all your responsibilities is something that's very important to me. It's a very difficult task for some of the students in our class that are top 10 and top student number one. I'm sure those students truly have it all figured together, but took massive steps to get there because it is a huge uptake. And I commend them for that, honestly. So my personal achievements this year, I've included some pictures to make it a little bit more interesting. I guess to touch base on academic achievements, I achieved Dean's List last year for 2023. However, academic achievement for me is only truly met when I've experienced major burnout first, which is something that I've grown to work on this year. I haven't experienced the workload that we did last year beforehand, so in matric or anything like that. Last year was a new hurdle to jump through. And I feel like I've only really mastered my time management and my work ethic properly this year. And for my leadership goals and achievements, I've had the honor and the privilege of being class rep for year 1 and year 2. And I pride myself on being a person that can, all the students that can lean on, complain to, look for support. It has become a very big part of my life, and it is a very big, I don't know how to word it. It's a very big honor, honestly. It truly is. And looking to patient care achievements, this for me is my biggest achievement that I would look back on this year and last year, and honestly, all my years. Because ever since I started my clinical days in first year, I knew I wanted to do more than just converse and treat with patients. Everyone can be a good healthcare worker, but not everyone can be an extraordinary one. A good physician to diagnose and treat, everyone can do to a certain extent. But what makes you extraordinary is having a good connection with your patients, to take the time to hear them, speak to them, make them comfortable, and ultimately give them your best possible care 100% of the time. It is just the next patient for you. I think when you enter in first year, you only have one patient throughout the day. So I do think you put yourself forward to say, I'm going to be the best I can be. But when you enter second year and you're seeing so many patients, sometimes with a supervisor, sometimes without, you realize that it might be a 5-minute or a 20-minute interaction with them, but for them, it's their entire day. I'm sure if you can look back on any hospital stays or any doctor interactions you've had in your life, yes, you can say, you're not telling anyone, yes, they gave me my treatment and it worked. You're telling them, oh, it was really good. They were really nice to me. Or if you've slept over at a hospital, you weren't commending how they put your drip in. You were saying, oh, the nurses were terrible to me. Everyone always says that. So it's so important for me to be a person in the healthcare space where they can say, oh, she treated me really well and I really enjoyed that. And it is a very big part of my life. And looking for skills achievements, this year we were bombarded with skills that were not only so exciting to learn, but become a really big part of your practicing throughout the years to come. Learning skills like suturing and doing chest strains, and obviously the reading of the x-rays and all of that kind of thing, especially like lumbar punctures. They're big, scary skills, but when you actually get to do them, it's really invigorating to know that you can, and that you're like doing something that I guess a lot of people can't say they can, and you actually enjoy it, which is something extraordinary in my opinion. You get to go to theatre and you get to do all of these things that you dreamt of, and you're only in second year, which is mind blowing, honestly, for the first couple of times. And then overall, overcoming challenges. I've put some nice little pictures there so you can see it's honest, if anything. I'm just going to touch base on overcoming scenarios and rotations where you feel undermined, where certain healthcare workers don't understand or respect BCMP. So talking on this topic, it is something that you 100% will encounter. If you're in first year or if you're in third year or if you're practicing, wherever you may be, it's something that you will encounter. And I grew slowly to get used to it, and you grow to have thick skin. One of our preceptors now in gynecology and obstetrics at Edenvale Hospital, that's where I'm placed, is Dr. Ramkhale Zungu. She taught us that to not take anything personal. You might have an interaction with a doctor where they might shout at you, or they might be snippy with you, and it means everything to you in the moment. You just want to cry. You think you've done everything terribly. You think that they hate you, but then you learn that like they don't know who you are. They don't have a reason to trust you, to lean on you, and you have to just earn that trust and show them who you are. And you'll learn to just put people back into perspective when people don't understand what you do, to just say, this is what a clinical associate is. I'm here to help you. I'm here to bridge the gap. I'm here to help patient care. I'm here to show you my skills. I'm here to show you what I can do. And when you learn to meet that kind of confrontation with that attitude, it goes a long way. And overcoming burnout in both the hospital setting and university is a big hurdle that I think a lot of students have to manage in second year. In first year, there is a lot of content, but I think in second year, you learn more about putting your content into practice, should I say. And while you're trying to manage all of your tests and assignments, you're also working with patients and you're working at the hospital. There's long hours and sometimes it isn't enjoyable. And you can see one of my colleagues having a nice sleep there. That was in the theatre, like, I guess, rest room. Sometimes this is your reality. You do have to make shift a bed and sleep 2 hours before you go back to theatre, and you're working overnight. It's a big adjustment. And you do sometimes hate it, but also you sometimes love it. And overcoming patient losses and bad outcomes was a very big obstacle for me, especially with the restrictions with resources at government hospitals. Um, it's something that everyone will have their day of, and you will reach your brink. Sometimes you do get attached to patients, and sometimes, even if it doesn't result in the patient passing away, it does result in there's nothing you can do for the patient. And it isn't a good feeling. And you do have to get that patient once to just realize it. And then after, I think you slowly become a little bit more desensitized, I guess, which is a good and a bad thing. But overcoming these burnouts and everything like that is very important. Overworking yourself is not a badge of honor, is something that my mom told me. Because burnout is a sneaky thing that you don't really realize you're borrowing time from tomorrow to push through today, and then it just catches up to you. Burnout doesn't fix itself after one relaxing weekend. It has to be addressed every day to create a routine, making time for yourself. And I find a lot of people I've spoken to find solace in a higher power. I've spoken to a lot of people that were not religious before this degree, or not religious before studying anything in healthcare, and now they are. I do think it is a very good coping mechanism for a lot of people to lean on a higher power, to say, I'm not in full control, but I'm simply a vessel. And it is something that everyone has to find a coping mechanism, whether it's if you are religious and have a higher power, if it's you you just have to find coping mechanisms that work for you, that aren't bad coping mechanisms. And then something that I learned from my mom, that she told me at the beginning of this year, when I was very anxious to obviously go into 9-week rotations and heavy workloads and studying and everything like that. My mom said, what you lack in natural talent can be made up for in discipline. So practice to be better. You don't have to be the brightest or the smartest in the room to be the best. So I take that and I carry that with me every day. How I plan to use my degree for my future career. So obviously, I cannot tell you where I will go. I'm a second year student. I do feel like a 17-year-old girl at heart. However, there have been some paths that have opened up for me that I've obviously worked on for myself. I worked for Professor Carol Ann Ben before I joined BCMP. I was an oncology au pair, so I watched children while their parents were getting chemo for breast cancer and radiation and all of that. And she put me to work after a couple months of that, asking me to do more, and she further sent me to study BCMP. I grew a very soft spot for breast cancer patients. I'm very passionate about breast cancer. We've just now ended Breast Cancer Awareness Month in October. And I do see it is a path for me to explore in the future. And I wouldn't say it's impossible that I do go back there. However, I am very passionate about pediatrics. I always have been. I just finished my pediatrics rotation, and I do think it sent me for a bit of a tumble, because I think there's a difference between loving kids and loving working with kids. Then when you have to experience them very, very ill, and sometimes before our rotations, we did have many workshops about gender-based violence, intimate partner violence, obstetric violence, as well as child abuse. And I do think that you think that it won't happen, but being in pediatrics and working with so many children that, yes, did go home happy and healthy was amazing. But seeing abuse cases and seeing neglect cases and abandoned children, it is very hard. So I do think that's something that everyone will experience when they go into their rotation. Sometimes your rotation that you think will be your favorite won't be. And it's all about experiencing it. So I can't say where I'll go. I still have the whole of next year to experience rotations and all the new faculties next year to figure out where my heart is. But I am very excited to figure it out as we go on. And then to conclude, ultimately, you have to fight through some very hard days to earn the best days of your life. And I found this quote very helpful here when I was in one of my most anxious stages of, I think, first year before mid-years. To know even one life has breathed easier because you lived, that is to have succeeded. And I found that, I think, on TikTok. And it really resonated with me because to be in this degree, you can't just be in it on a whim, or I've heard a lot of med students tell me they're in it for the money and stuff like that, because it won't work out that way. You need to have the drive to be the best you can be, the passion for the patients, the passion for healthcare, especially in South Africa. Where your passion is, your success will follow, as helping people at their most vulnerable truly is a privilege. They may never forget your name, but sometimes they would forget your name, but they will always, always, always remember how you made them feel. I've had some bad days at the hospital, but I've also had days where I didn't want to leave. Mornings where I was so excited to go back because it feels like you belong there. And I truly did find that in casualty and in emergency medicine, where a lot of people enjoyed their rotations there because you do feel like you're actually making a difference. Obviously, with third year in the rearview mirror still, I'm not sure what lies ahead for certain of where I'll end up, but I know it will be in healthcare and proudly a BCMP graduate. I always say that this wasn't my backup plan, my second option, or anything like that. This was the only degree I applied for at the only university, and this was always my plan, and I always felt that this is where I had to be. And I'm so honored to be here and speak on my experience, my achievements thus far, my goals, and I hope that we can build and carry on building up students to see this degree and uplifting BCMP, its reputation, its importance, along with the foundation that's been given to us of all those that came before us. I'd like to wish everyone good luck for the upcoming exams. For anyone that's very stressed, I hope you can just remember my mom's words of discipline will take you a far way. I hope you have a good night. Thank you for having me.
Thank you so much for that, Gabby. That was amazing. We are really grateful for your time and your valuable input. We really are. Yeah. Okay. Last but certainly not least, I'd like us all to meet Rachel. Rachel is a final year clinical associate student with a deep passion for healthcare and a drive to make a difference. Rachel is an advocate for the clinical associate profession, but that's not all. She's also, when she's not in scrubs, you can find her making music, harmonizing her love for melody and healing. And today she will share unique insights and experiences from her time at FITS, offering valuable perspectives on what it means to be a clinical associate student.
Good evening, everyone. I hope that you are all doing well. You are keeping cool. The weather is getting hotter and hotter. I called it spilling the tea because it's always like that. Everybody asks so many questions about BCMP and you have the little information paragraph on the university pages, but hearing it from the actual students is something completely different. So this is BCMP 101 spilling the tea. I have put 3 pictures here just as a reflection for myself. The one in the middle was our first visit to the hospital. That was South Rand. The one on the left is to honor Mr. Victor, who was so incredible. May he rest in peace. And the one on the right was my most recent visit to the hospital. That was my last rotation. My name is Rachel. I am a 21-year-old first-generation foreign immigrant from Zimbabwe. I'm a final year student, as has been said. And I'm so fascinated by medicine and passionate about serving my community. It's what makes me so certain that BCMP is the place for me. I love to read and write, and I am a musician. I sing with the official choir of the University of the Witwatersrand, as well as an international renowned and multi-award winning adult choir, Quavo vocal group. And in both choirs, I do hold leadership positions, being in charge of the different voice groups and operations and all the projects that the choirs have. I am a people person. I like to talk. I research a lot from different sources, social media, articles, people. And so I like to believe that I have a lot of knowledge and information to share, which is part of why I have started falling in love with this profession, is because there's so much to know and learn about BCMP. There's so much uncharted territory, so many different spaces that we can learn to occupy. I'm a lover of life and I'm curious about the big wide world around us. I try to live my life to the fullest. And if anyone asks you, I am a natural blonde, yes. So, my journey, what even is BCMP? My first year was in 2022, and when I applied in my matric year, like a lot of students, I had no idea what this was. I honestly just signed up for everything associated with medicine. Um, and so when I eventually entered, because of how uncommon this program is, me and a lot of my colleagues, we went through phases of denial and confusion. And a lot of us decided that BCMP was great, but it was a second option. It was a launching pad to take us somewhere else. And so we made a lot of plans to leave as soon as possible, whispers of GIMP and graduating and starting another program and all these different things. But I can tell you today, after 3 years of being in this program, I'm so close to finishing. I am so proud to be a soon to be clinical associate, and I enjoy talking about what that is and how important this profession is. This year in particular, final year, has been incredibly difficult. I cannot stress that enough. I think in the first 2 years, we are quite shielded in that we can hide behind the guise of being just a student. You have all this work to do, but she's just a student. But in final year, we were thrown into the full experience of the life a working clinical associate might lead. The mornings were so dark, the days were long, and the nights were not long enough. Having to balance between managing other aspects of your life and then also being a clinical associate student and staying on top of that and then studying for the national exam has been a very heavy burden to carry. In the clinical space, the pressure to do things and to do them right was very heavy on our shoulders. You're in your final year, so you should know most of this stuff, right? Wrong. We still had a lot to learn. I had a lot to learn, which will bring me into my personal achievements that I am particularly proud of. I'm speaking mostly about the clinical ones just to give other students that are in first, second year an idea of what being in final year would look like in terms of clinical skills. So one thing that I've learned in final year is that to succeed in the clinical space, you have to study, you have to study. You have to be confident and assertive, but you also have to make allies and ask for help. All the new skills I learned and procedures I did and spaces I entered were because I was best friends with the sisters at almost every site I went to. The sisters were my sisters for real. They were my mothers and my aunts, and they supported me and they spoke, put in a good word for me with the doctors so that they would trust in my potential. And where I wasn't sure, I asked for guidance. So these are some of the things that I did this year. I improved my counseling, and something really big was that I helped talk down a suicidal patient. We spoke to patients that were having psychotic episodes in the mental health rotation, which was a really big thing because when we study it, it's different from doing it in practice. You're trying to think of all the right things to say, and when you're in the situation, you freeze. But we successfully did that. I increased my theater time, doing C-sections, colostomies, appendectomies, assisting in appendectomies, debriding wounds, some orthopedic surgeries. I also got the opportunity to work in pediatric surgery during my elective, which is surgery is so fun. It's absolutely beautiful. You learn so much, especially if you have great teachers. I did more lumbar punctures, pleural anesthetic tabs on my own, inserted lots of chest drains also on my own, presented in multiple ward rounds, which can be very daunting. It's incredibly scary when you're surrounded by all these doctors and registrars that know everything, and you're there, little old you presenting your little patients. But I did that in multiple rotations. I held my own in a ward alone with a team of nurses where my interns perhaps had to work in OPD and somebody had to be there to manage the patients in the ward. And I worked successfully in a pediatric ICU where I was entrusted with managing patients under supervision. So I had my own caseload. That's all well and good. It's beautiful. But the actual tea is that it is never roses and rainbows with us. We face a number of difficulties every day, not just the students, but as clinical associate students. And the number one challenge that I have faced that I'm sure all of us can relate to is the uncertainty surrounding this profession and then the condescension that follows. People look down on you because they don't know what it is. They ask what you are, you try to explain, and suddenly you're stuck filling out discharge summaries for 4 weeks. You're doing drips every day when there's so many other opportunities to do so many different things and learn so much more. But like I said, you look down upon because what even is BCMP? And the solution that I found that worked, and we don't like it, but a friend of mine advised it and it worked like a charm, is to be assertive. Because the degree is so new, we are kind of trailblazers, I'm going to say that, as are the people before us that have allowed us to even be in these spaces. So you need to stand your ground and be assertive, not be rude and disrespectful, but be assertive. Know your stuff so that your confidence is warranted and backed by your passion and skill. When they see how passionate and how serious you are about what you're doing in the hospital, they will take you seriously. My friend said to me, you will not get opportunities if you feel sorry for yourself. If you allow them to push you in a corner, you will stay in that corner. We don't like that solution, but it is a solution. I started to redefine what a clinical associate was for myself, for me to be able to be proud of what I am representing when I get to the hospital. When that definition needs other professions to create a comparison of some sort, that is a gateway for you to feel lesser than, even though you are so important to the healthcare team. So when you define a clinical associate as something in between a doctor and a nurse, or a doctor's right-hand man, or a junior doctor, that is not a good place to start. We are clinical associates. I am a clinical associate who is trained to see and manage patients holistically, diagnosing pharmacotherapy where necessary, and seeing them through to recovery. And repeating this to myself, ingraining it in my mind, really gave me a sense of pride that literally nobody could shake me. Sure, some days were really bad. We know how it is, but it never changed my pride that I'm coming here representing the clinical associate profession. I am a clinical associate student and nothing else. What my future looks like. So I have a passion for children, like Gabriella, much to the horror of anyone that has worked with children. I know. I love that she said there's a difference between loving children and then loving working with children. I love working with children. I hate to see them sick, and I think that's what fuels my passion for them, is to do everything I can to get them better. I love the potential that comes with children. I love their innocence and the genuine awe of the world around them. I love how honest they are, how genuinely they ask, is your hair actually yellow? Because that's abnormal. I just enjoy being in their space. They make me feel young again, and they give me hope in the developments that medicine is making to continue to treat some of these conditions. So naturally, I'm hoping to work in pediatrics in the long term. During my elective, I had the opportunity of working at the Nelson Mandela Children's Hospital in the pediatric ICU and pediatric general surgery, and I'm hoping that they will take me back. I also have interest in obstetrics and gynecology, and I think it would be a good place to start just because I would like to study further. Like I wrote here, I'm postgraduate diploma in child health to further my knowledge on pediatric medicine and use it to bolster up my CV and hopefully use that as a launching pad into pediatric medicine, and I can take up space in that area. A little motivation. Gabriella said, you cannot be in this degree just because the days are so hard and you're going to need something to keep you there. And that cannot be money. It cannot be just for vibes. You cannot stay there for vibes. Some days are traumatic, some experiences are so hard, and they will take so much out of you. And that cannot be explained by just for vibes. You need to fall in love with this degree. You need to fall in love with medicine. If you're here to jump to another degree, you're throwing away so much hard work, so many tears, so many long hours, so much information, and so much time. You have to learn to love it over here. You just have to. The next thing I would say is to study. It's very important. And this studying has to be very specific. Don't study for the test. Don't be short-sighted about your studying. You are going to be a practicing clinician. That's why we're here. Study to save lives. So your studying kind of has to go above and beyond what BCMP provides for you. You have to do your own research. You have to be fascinated by this medicine thing. What's going on in the world? What's new? What's treating what? Is there something for cancer? Is there something for HIV? What's happening? You have to study. And when you're tired, study some more. Um, for exam specific motivation is to create a schedule, because we know this degree is a lot. It's a lot of information in such a short space of time, and you will get overwhelmed if you do not pace yourself. In the 3 years that I've been here, I have learned that creating a schedule is so important. And while you're creating a schedule and creating your study content, do not separate the subjects. That's another thing about this degree, is that everything is quite integrated. The first half of the first year, I think they're separated, but after that, everything is very integrated. Your anatomy, physiology, and pharmacology, they all go hand in hand. And so I always recommend to anyone that asks me for advice and study tips is to study system by system. So if you're doing the respiratory system, do the anatomy, do the physiology, what conditions could come about, and what anatomical parts are involved in those conditions. What is the pharmacology? How would you treat those conditions? They all go hand in hand. If you separate them, it's not going to work. They're going to be separated in your mind. And when you get to the clinical space, it's going to be difficult to actually bring all that information together to manage a patient properly from top to bottom. So I always recommend studying system by system and then using clinical cases to reinforce your knowledge of how the body works and how diseases present, how to treat them, how you manage a patient with medicine and also without medicine. And the last thing I would say is take breaks. Find something, anything that is not medicine to relax or to turn to. I love what Gabriela said, is that a lot of people have turned to a higher power, and so they enjoy church, religious, even anything to give them hope, relax, take your mind off the medicine. You need to take care of your mind. Burnout is a very real thing, and it's a hole that when you fall into, it is very difficult to come out of. So you need to take care of your mind, take care of your mental well-being. If you have to ask for help, ask for help. Never ever suffer in silence. There is a lot going on. People will die under your watch. Some days will be so traumatic. A doctor is going to yell at you in front of everyone. A doctor is going to embarrass you in front of everyone. If you need to take a break to breathe, take that moment to breathe. No one is saying stay there until you die. No. Take care of your mind. You cannot help others if you yourself are not okay. That's the end of my little presentation. I hope, if anything, I have, shared some insight on what final year looks like. And if there's anyone that's not a clinical associate, come and be a clinical associate. Thank you very much.
Thank you so much for that, Rachel. I really enjoyed that. And I'd just like to extend a huge thank you to all three of our speakers for their time, insights, and inspiration. Your experiences has really provided us with invaluable guidance as we navigate our own paths in BCMP. And we truly appreciate your contributions and being here with us today. So we're going to move on to the Q&A. I have already received some questions. So for the first question, it is for our first year, Ponalo. So what communication skills worked for you for patients to open up to you?
Communication skills that work for me. Eventually, most of the time, we are taught like a way to most of the time you will be taught like a way to like ask questions like Socrates, the 5 A's very important during counseling and communication. But then most of the time in real case scenarios, you will realize that it's not always will you go into that week where everything just goes like by order. But then most of the time you would want to like be calm, collect yourself, to not stress, do not worry about anything, and then let everything flow. But then if there is something that you missed, make sure you go back to clarify that, because if you don't clarify it, it may cause to some miscommunication and misunderstandings that we really do not need happening, especially in the healthcare clinical space. But then I would say is to believe in yourself and then have confidence in yourself and allow yourself, well, not necessarily make mistakes, but leave room for improvement, that there's always something new to learn. So just go with the flow. Trust yourself. You've got this. And then everything will just happen the way you want it to happen. That's what I would say. Thank
Okay, that's perfect. The next question that we have is for Gabriella. So what skill have you learned recently for this block?
I'll touch base on two aspects of it. I think that I learned specifically this block, I'll mention one clinical and one just in general. I think the clinical skill that I learned this block that I guess I did not learn specifically at university is, which one was the most important? Even as recently of today, I learned about a skill that they did in theatre about checking if the bladder was filling correctly. They used a saline like you use for the drip. They took a bag of saline and they ran it through the catheter inside the body to see if the bladder was inflating, and then to then run it out. And then throughout that procedure, they figured out that there was a leak in the ureter, not in the bladder itself. And I don't think you would have thought that at university. You learned how to run a drip and how to insert a catheter, but I didn't know that it could go the other way around, which blew my mind. So that was a clinical skill that I learned, because that's quite an easy skill to complete, but served a huge purpose. And then I think a skill that I achieved that wasn't clinical is, I'll always turn back to the skill of like communication, of in a deeper retrospect of just, I've seen many cases where there was a patient that had overdosed on Allergex, and she was a mother of 4, and she'd had 7 pregnancies and had 4 kids, and all of them were very close together. And she overdosed on Allergex at home, and the intern on call that day was very tired and very, very overworked, should I say. And she was, to a certain extent, I think, irritated by some of the suicidal patients and brushed her off. And this woman didn't want to receive a drip, and she said, okay, well, then you can go home. And she got up off the bed and she attempted to leave the hospital. And I told the security to go fetch her and bring her back. And I spoke to her and I said, you took over 2 boxes worth of Allergex, and that's quite a lot, and you had a reason for it, so let's talk about it. And she didn't want to talk about it at first. And I tried to get through to her, and I explained to her that it would remain confidential and she could confide in me, and I just wanted her to speak me through her mental state of why she came to this decision. And she opened up to her troubles at home, and that she wasn't feeling well, and that she was felt overworked, and that she couldn't lean on anyone. And it was those kind of interactions I had with patients where you properly just look at them in the eye and speak to them and let them know you're actually there to help them and to speak to them, and you're not running off somewhere else and they're not just something on a to-do list. You just want to be there with them and just communicate. And I think communication in general, this block and last block of our rotations, I really came together with, of it's not just something to rush by, but to actually get the full history, not just there's the patient, she did this, and this is, we're going to send her to psych. It was a full, let's bring it full circle and break it down, because she didn't need to be sent for all of these things that she didn't need. She wasn't suicidal. She told me she just wanted to sleep, and she kept taking them and kept taking them, and she couldn't go to sleep because she felt so busy in her mind. And I just think if I wasn't there to speak to her and actually get through to her, I don't know where she would have ended up, and she maybe would have just gone home unspoken too. And I think that's an important skill that I learned this year that I'll carry for the rest of my career.
Thank you so much for that, Gabby. That really does sound like an amazing experience. Okay, and then lastly, Rachel, this is your question. How did you manage building relationships with healthcare workers in the hospital?
You are going to have to continuously remind them of who you are, continuously. But what I have found has worked for me is, like I said, the assertiveness and confidence, because you know what you're doing. You are there to do what you gotta do. You know what I'm saying? Um, a lot of the doctors that I still talk to now, that I have their contact details, I'm waiting to graduate so I can ask for jobs. But a lot of them that I have their details, it's not necessarily always because I came and I said, "Hi, my name is Rachel." They were just impressed. For the first time of our interaction, they might not have remembered exactly who I was and what exactly I was studying, but they were so impressed that there's this person who's just doing things. You tell her to do this and she's on it. You tell her to do that and she's on it. She sees a patient, she gives the management, she's ready to go. And that impressed them. That, they were like, wow, okay. So you're serious about this medicine thing. And that's how I started to create these connections with them. So be assertive, be confident about the space you're entering, about the knowledge, be confident about what you're representing. You are a clinical associate. Even if it means, correcting patients in front of the doctor and saying, no, I'm not a doctor, it's not Dokotela. No, it's a clin A, and the patient learns and the doctor watches that interaction. That's what they're impressed by. I don't know about, explaining all the time. That doesn't always work, but the energy that you bring to that space is definitely what's going to help with forming these connections. They are so impressed by the amount of knowledge that clinical associates are taught. They don't know what we're taught, so they're impressed by it. They are so impressed by the skills that we learn that they don't even have to teach us. We go there and we say, where do you need the drip? I'm ready to put it up. Let's go. They're impressed by this, and that's how you form these connections. Continue to engage with them, volunteer for things, ask them questions, ask them for guidance, but engage with them. If you're going to sit in the corner and like trying to disappear into the wall, that is definitely not going to work. Engage with them, engage, take up space. It is your space. You are part of the healthcare team. Take up the space, and they will remember you for sure.
Thank you so much for that, Rachel. I think a lot of us will be taking that advice. And yeah, I'd just like to say thank you for everyone that joined us tonight. If you have missed the webinar during the course of the year, you are welcome to catch up with the webinars on YouTube. The YouTube channel's name is Division of Clinical Associates, and the webinars will continue in 2025. I hope everyone has a good evening, and yeah, that brings the webinar to thank you so much.